All right, welcome all of you to this presentation. This is uh, the the second presentation that we are having on health policy. So in this presentation, we are going to look at the process of policy making. Um, so what are the steps that policies or what are the stages that involved in policy making? And what factors influence what we call agenda setting, uh, policy formulation, implementation, and evaluation. And then I will also look at some concepts related to uh, the influence or the role of evidence, values, and interests, and also power in shaping health policy decisions. So that is what we are going to look at. So when we look at uh, policy making, we are basically saying that it is the way in which policies are initiated, developed, formulated, initiated, and negotiated, communicated, implemented, and evaluated. Okay, if there is going to be a new policy on any health problem that is going to emerge, who are the people who really shaped these policy changes? Um, and then that initiation and following it through until implementation and evaluation. How, who are the actors? What are the factors involved in that? That is basically what we look at when we're looking at uh, policy making. So if we go more specific and look at the health policy making process, we are saying it's basically the same thing, but in this case, is looking at matters that pertain to health of the population. And when we look at the matters that mainly relate to health of population, we look at the structuring of health systems, how health services are delivered, and then the interventions that promote public or the health of the population, basically public health. So when we're referring to health policy making, we're basically stressing the way in which policies that relate to health are developed. So one point that you need to note is that the process of formulation of policies is not uniform. Okay, it's not uniform. Um, some stages can be actually skipped depending on what health matter we're talking about. So it is not that we will have exactly to move from one point to the other or from one stage to the other, but usually most policies go through the 5 stages of agenda setting, policy formulation, decision making, policy implementation, and then policy evaluation. I just want to ask 1 minute. Um, are you hearing some background noise?
Not yes, really. We are so clear.
Okay. If you're not hearing, then that's okay. So when we talk about policy agenda setting, this is basically to refer to the fact that you see, we have a number of health problems, but what health problems are going to be addressed by a policy of this? So which ones are going to be prioritized? Which ones are going to get the attention and the resources such that the policy is developed to tackle the problem? Okay, so you just need to keep that in mind that when you are making a policy, there are many competing ideas or competing issues that need to be addressed. So how do we make sure that the issue that we are focused on is the one which actually gets addressed? That is what we call agenda setting or policy agenda setting. Okay, so we usually have problems, of course, in our context. The budgetary allocation to health is low. Okay, you have poor health outcomes for different populations. We have high maternal mortality. We have high infant mortality rates. We have low number of health workers. We have health workers who are not well enumerated. We have a number of these problems. So which problems can actually be addressed? Okay. Um, how do you make sure that the policy makers prioritize the problem that you are actually facing and you want it to be addressed? That is what you call policy agenda setting. Okay, like I said, the problems are enormous. They come from different angles, whether it is about the delivery of health services, whether it is about resource allocation or budgetary allocation, whether it is about you health workers, whether it is about making sure that the uh, health training is free for citizens or those who are eligible or people have to pay. So we have a lot of problems. But there are some problems that can easily get onto the policy agenda. Okay? There are some problems which can easily get onto the policy agenda. The moment they emerge, then they can be addressed. For example, serious political threats. Okay? So if we have a political issue um, that threatens to remove, let us say, the government in power or threaten the government in power, then that problem will be addressed because it is an imminent danger to the government in power. It can be a national threat issue, or for example, if we have a deadly infectious disease that is affecting a given section of people and it has high mortality, it is highly infectious, it is a national security matter. Bioterrorism is a national security matter, so it needs to be addressed. Um, some of the challenges can be the usual day-to-day things that we actually face. Then, when perhaps it lands onto or it gets the attention of particular policymakers who may pick interest in them, then those problems can usually easily get onto the policy agenda. And then we have what we call rationality, that people really think through and understand the challenges that we face, and therefore they commit themselves to solving them rationally, using their mind and analyzing the problem and saying, no, this can't go on like this. And then the other way is, is how you actually frame the problem. With this, we are referring to the fact that if you don't package the problem very well, if you don't present it in a compelling and in a way that can persuade people to understand that this problem is to be sorted, then that problem can either go onto the policy agenda or it may go. So you need to know how to package the problem. You need to know how to use evidence, a compelling narrative. You need to incorporate a number of aspects in order for the policymakers to pick interest with the problem. Okay, so you need to clearly state the problem. Okay, if you don't clearly state it in a way that is understandable to policymakers or to legislators, then you will have issues. People will not really understand it and they will not push for it, or they will not influence for it, or they will not advocate for it. Okay, so you need to want to clearly define the health problem. Who is it affecting? Where? When? That is basically the scope consideration, or whether you of course now have to come in, if it's a health problem, you need to use the knowledge of epidemiology to describe this problem. Okay, so um, this brings us to the aspect that policy making is a multidisciplinary um, endeavor. Okay, you use knowledge from different fields in order to be able to push for a certain policy to be formulated and then implemented. Okay, use evidence, provide the numbers. Okay, give us the numbers in terms of either mortality or mobility issues. How many people are being affected by the problem? Where are they? What category of people are they? Women? Are they old people, older people, or are they people with disabilities? And then also look at how you can get input from other stakeholders. What are other stakeholders thinking? Now, if you have all these elements, then it means that your problem is going to be very articulate and very compelling. Therefore, you can get the attention of the policymakers. One of the things that you really need to know is that you have all these problems happening, but not all problems will be addressed at the same time. One of the things or one of the models that helps us to understand where the problem will be solved or not is what we call Kingdom's three-stream model of agenda setting. This is to say that there should be a moment in time where the health problem that is existing has got a solution for it, and the politicians or the policymakers are willing to deal with it. So we have the three streams: the problem, the policy, then the political will or the politics. Basically, these are P's. These P's should be available at any given moment. If you have a problem and you have a solution, but the politicians are not willing to solve it, then there will be no action taken. So no change. But if you have a policy and then you have the politicians willing to handle the problem, there is no actual problem to be solved, then no policy change will happen. If you have the problem, the policy, or that is basically a solution, and then the political will, then action will be taken. So that is basically what we call the Kingdom's three-stream model of agenda setting. Okay, so sometimes you will see that there is a problem that needs to be solved, but the politicians are having their interest in other matters. For example, currently, if you look at the landscape of South Sudan, the interest is in enactment of laws that will lead the country through peaceful elections in the 2024 December. So any other policies that other than those, any other laws other than those are not given attention. Okay. This is especially in terms of the constitution. Okay? So all the legislature, okay, the National Assembly or the Parliament is interested in passing all those laws that will facilitate the elections. So nothing else at the moment. Okay, so that is that. So how do you make sure that you can push your agenda or your problem that you want to be solved, such that it can get onto the policy agenda? You need to know the key people who can help you, who are very influential in the government. Okay, how do you approach them and deal with them? Okay, so you need to know that yes, even within the government, not all people have the same influence. Not all people, not all government officials have the same level of political influence. Okay, so you need to know that you need to convince certain government officials who can later on become champions of your health problem that you're trying to address or advocate for. And then we have what we call interest groups. These are what we call the lobbying groups or the lobby groups in the current context of South Sudan. And this is what we are having as one of the challenges, is that we have lobbyists, but these lobbyists at the moment are lobbying for political positions, not for policy change. That's where the biggest problem is. So if you'll find the community leaders arranging for meetings with influential government officials, such that maybe their son or their daughter gets an influential position in the government. The idea should be that the lobbying should be towards making sure that they have policies that can actually benefit everyone. Okay, so that is interest groups. Um, for countries with vibrant political landscape and the private sector, you will have interest group, people who are interested, let us say, in the pharmaceutical industry, who are interested in the tobacco industry, who are interested in the brewery industry. These people will want to make sure that the government does not impose a lot of restrictions in their industry in terms of regulations or laws. Okay, so they will always lobby. Okay, they will always lobby. So you have the, let us say the pharmaceutical industry organizing workshops, organizing sometimes even trips, and giving handouts in order to influence the way government officials actually think about some of the activities that they have in their industry. And then we have the media, the radio stations, the print, the newspapers, the television, even social media. This helped very much in how problems are framed and whether the public will take interest or not. An example of a problem that had a lot of prominence in the media is the problem of or the issue of drenching of the Suez Canal. Okay, you saw that the uh, the the people who are against the drenching of the Suez Canal used their social media platforms to really point out the reasons as to why this should not happen. Okay, and then the people who were for the drenching did not actually use this platform, and overall you could see that the public opinion, what people think generally is that the Suez should not be drenched. Therefore, eventually, when the president came out, he said that there should be a committee that should carry out research and tell us the recommendation on how this issue can be actually handled. Okay, so you can see that the role of the media is very, very important in influencing how certain problems are going to be handled. And then what are people really thinking? That is public opinion. And um, how do they share that opinion? One of the issues that had a lot of discussion on social media was the issue of um, giving, um, solving the problem of water in Juba. And one of the recommendation was that government is going to allocate 90 million US dollars to buy about 100 water trucks to supply the citizens of Juba with water or the homesteads with water. And then you could see on social media that most people were really against it. Okay, so at the end of the day, it is very difficult to see that actually the government will implement this because the people have really expressed the fact that that is not a sustainable way to deal with the problem of water. So public opinion is very, very, very vital in setting and shaping policy. The interest group, I've already said that you have cliques of people who are interested in a particular topic. Okay, I've given you the example of it could be the tobacco, pharmaceutical, it could be any industry, even it could be associations. They could have their own interests that they want to be pushed forward. It could be unions. Okay, it could be an organization that is basically there to do lobbying. Okay, lobbyist organizations. Okay, So you set up your organization like, okay, my clients are people who want their issue to be pushed forward. And then the lobbyist organization design a plan to make sure that the issue is actually addressed. Okay, interest groups are also very important in also shaping the politics of the country. Uh, you have you have groups who openly support certain candidates by even giving funds. Okay, so lobbyists do a number of things. The interest groups do a number of things. They make sure that the problem that is of interest uh, goes out. It is the message is spread out such that people really know about it through media campaigns, through protests, through community events. Okay, they also use research. Evidence is very, very important. So carry out research such that you can really push the idea or the idea with evidence. That is very, very important. But it's also very important to work with other people such that you can amplify their voices. Okay. Um, get partners, get stakeholders who are interested in the health problem, and then push it together with them. Okay. So, for example, in the context of South Sudan, the problem, let us say the problem of early child marriage is one that you can see that the number of actors who have come together, Ministry of Gender, we have NGOs, UNFPA, and others coming together to make sure that the vice of early child marriage is actually stopped. And then issues of GBV, for example, also have seen a rise in partnerships. Okay, so these groups can be various categories. I mean, they are diverse. The groups that I've given you, the pharmaceutical interest groups, it could be the tobacco interest groups. These are basically what you can call the industry groups. Okay, they will inject resources to make sure that the policies that come do not um, um, damage their businesses. Okay, the regulations, the pricing, the way healthcare is delivered. These interest groups will make sure that they influence the way policies are actually made. And then we have organizations that advocate for the rights and the rights of patients, what you are calling patient advocacy groups. Okay, and these usually use a number of stories, emotional appeals to make sure that people actually get interested in some of these matters. And then public interest groups, where you have groups that are interested in a particular problem. It could be environmental health, it could be gender-based violence, it could be about abortion. Okay, and these are about particular health problems that actually affect the population. Okay, so we have seen that the first stage is about setting the agenda. Okay, making sure that your health problem gets the attention of the policymakers. Now, the next step is now the process of formulating the policy. Okay, now you have this problem. You have a number of options. Uh, so you need to make sure that you choose the right option. What needs to be done about this problem? Okay, so you need to use evidence. You need to conduct what you call cost benefit analysis. This is where now two disciplines come in. Evidence usually can come from epidemiological data. So epidemiology is very important in policy formulation. And then the second one is cost benefit analysis. This comes from health economics. So you need to be in position to say that if we implement this, this is what we can, it is the value in terms of monetary, in terms of monetary value. Okay. So, for example, if we implement a policy on um, against early child marriage, what value, what financial value are we able to get out of it? Okay, so you should be able to compute and say that if we invest this into this policy and intervention, this is what we are likely. So the cost benefit analysis, how much it goes into making sure that the policy is made, implemented, then what do we get out of that? Okay. And then you also need to have the skills of negotiating, also knowing how to compromise, because you will have different interest groups. Okay. For example, for abortion, if, for example, the topic is about abortion, you want to formulate a policy on abortion, you will have people who will say abortion should be legalized, and then you have people who say abortion will not be should not be legalized. Okay, so that means that depending on the side that you're on, you need to be able to negotiate such that the other people do not completely oppose it, but uh, can incorporate their ideas into this policy such that there is a kind of compromise or consensus on the issue that you're actually addressing. Okay, so you have policy formulation is about gathering all this. Then with policy or decision making, you need to make a decision. You have a lot of options on how to solve a problem. Now you need to make a decision on what you can actually do. Okay, so decision making is very important. And for you to make a decision, you need to be based on evidence. And I've said so far, as of now, that you can get evidence from economic, the economics, the financial implication of a policy, and then what evidence is there that suggests that actually the problem needs to be addressed, or that suggests the magnitude of the problem. And then, of course, you not make a decision based on the financial aspect alone or the evidence that you have, but you also look at the ethical implication of the options that you have. And you don't want to have a policy that infringes on the rights of populations. Okay, so you need to look at the ethical implication of the policy options that you have. Then come up with look at all of them, then choose what is better. But as you're doing that, you need to engage with the people who have interest in the health problem that you're actually handling. This could be the communities affected by a problem. It could be experts who have knowledge and experience in the problem that you're dealing with. Get their views on the problem such that you have a very good understanding of who lies where. Okay, so we have diverse stakeholders. We have those that will oppose, and then we have those that will support, and then we have those that will not have a side. Okay, so you're just there. So how do you handle them? So you need to know, or you need to be able to conduct stakeholder analysis and know the techniques to handle each of those. Okay, so now if after coming up with the options, you make the final decisions, you can use a number of decision-making principles or models or frameworks to be able to come up with the options that you're going to undertake. Okay, of course, most of you can have a number of options that are feasible that you can really implement. But again, you need to look at other ways, other principles such as the cost benefit analysis that we talked about, equity issues, then feasibility issues. Is it practical? Do you have the resources to implement it and all those things? Do you have even the human resource to do that? So you need to make sure that you have a clear criteria in which you're going to evaluate each of your policy options for you to arrive at the best way possible of going forward. And then you need to make sure that you really understand the environment that you're working in. Be transparent in everything that you're doing. Make sure that you communicate with the stakeholders. Know the trade-offs or the compromises that you have to have other plans in place, okay, or what we are calling contingency planning. Make sure that you have other strategies that you can use to manage other emerging issues that that can come as you move forward with the with the policy making process. The next step is now the adoption. Okay, this is now you have chosen the options to take to address the health problem, and now you have generated the consensus. Everyone is okay with what the final policy. Now it's about the if it is about a national health problem, then it is the legislature now undertake the processes of legislation. Okay, the reading of the bill until the bill is adopted by the legislature. Okay, so if it is adopted, usually it is sent to the president, and then the president can endorse it. Or it's actually sent to the Council of Ministers for the context of South Sudan, the Council of Ministers, and then if it is approved, then it becomes a policy. Sometimes, and this is why I said earlier on that the policy making process is not a linear one where you need to move from one step to the other. Sometimes the president can wake up and issue what we call an executive order, which are basically decrees. Okay, the president can wake up one day and say, "I write a decree, and it is ready on SSBC, and it is implemented." Okay, so it may not go through the parliament and things like that. Of course, with executive orders, you still have other similarities with the usual policy making process, where you have people even lobbying, lobbying the presidency to make sure that certain things are passed, are issued, or certain executive orders are actually issued. Sometimes before the policy is passed, whether it is a law, it also has to go through the judicious arm of the government. Remember, the government has two arms: the judiciary, the executive, and then the legislature. Okay, so one of the ways in which policies can emerge and come from, they can come from court rulings. Court rulings can become policies. Okay, as we saw in our first lecture. Now, in other situations, you have the policy going through the legislature, but before it is discussed or passed further, it has to go through a judicial review to see whether whether the bill has contradictions with the existing constitutional frameworks. You don't want to have a policy or pass a law that is contradicting with some of the articles in the Constitution. So a judicial review is very, very, very vital in that case. And then you have now the implementation. So after passing the bill, how do you make sure, or after passing a policy, how do you make sure that it is actually implemented according to the outline, how it was framed, the details. So usually this one, you need to make sure that you have the resources, you have the staff, you have the infrastructure to support the execution. So that means that in your policy document, last time we looked at the parts of the policy document, and implementation is one of the parts. So you cannot just pass a policy without clearly stating how that policy will be implemented. Who is going to do what? What resources are they going to use? Where are those resources going to come from? It's very, very, very important. And it's one of the challenges that we actually face. I remember one of the policies that was passed by the Ministry of Health is the uniform policy for nurses and midwives in the country. The problem with that policy is that it was passed, but the implementation is almost there. What are the challenges? One is that the policy was not distributed to the different health facilities around the country. So there was no budget for distribution. Okay. So later on, that was identified as one of the problems. And then the distribution did not follow, was not actually planned. Okay, and so that was one challenge. And the other challenge was that, you see, you can't tell the hospitals to buy uniforms for midwives and nurses when they don't have the resources to buy these uniforms. Okay, that's the other problem. And then the other problem is that you can say, okay, let the nurses and midwives buy these uniforms. But then these are people who have gone for 4 months without paying it. So where do they get the money to buy these uniforms? So that was the other challenge. The other challenge also came in that the nurses or midwives who were actually putting on uniforms were actually being targeted. Okay, so if there is an issue of, let us say, medical negligence, the person comes with their gun and say, where the nurse? And the nurse is be visible because they have a uniform. So they will be attacked. So not wearing a uniform actually becomes one of the ways of protecting yourself against such attacks. So if you don't think through the implementation of the policy, it will not work. That is a very classic example. So you want to see that if you implement the policy, you want to get feedback from people, what they think about the policy. So you need to get input from stakeholders. This is very important for you to refine the policy such that it adapts, it is well implemented. So you need to listen, keep an ear, keep listening, okay? Keep an ear on the ground, see what is happening, and then adjust things. So you can have modification as one of the things that you can. So there is this concept of health in all policies, which is that um, most of the policies in other sectors, whether it is transport, whether it is aviation, whether it is forestry, whether it is land use, whether it is petroleum, all these sectors have an influence or have an impact on health. And therefore, if you're going to have policies on these sectors, you need to make sure that you think about health matters. That is what we call health in all policies approach. This therefore means that there should be collaboration. Okay, collaboration is very important. If you are in the housing sector, if you think about having a plan for housing in Juba, for example, you need to involve the Directorate of Health, or you need to involve the Ministry of Health. It can't be the Department of Health, it can't be the county department of whatever, but you need to involve the people who are in the sector. So that is about the health in all policies. So let us look at South Sudan. What are the dynamics in terms of policy making? We need to understand the structure of the national government. What happens? Okay? What happens? How are these policies made? Okay, what are the roles of the different arms of government? So what really happens? Where is the power? Things like that. So let's start. Of course, we earlier on said that the government has three arms: the legislature, or which is the legislative assembly, the executive, and then the judiciary. Okay. And in this presentation, I will not say a lot about the judiciary. I'll focus a lot on the legislature and the executive, and we will see what really happens. So the legislature currently consists of about 500 MPs, I think. All these are appointed. So perhaps if the election happens in 2024 December, we shall have elected representatives, not appointed. So the assembly is the one that enacts national laws. But like I said, currently the focus is on making sure that we have enough regulatory frameworks, legal frameworks for the election. So policies or laws that relate to the elections given priority at the moment. The other issue is that you have the Ministry of Health uh, drafting its budget, but the approval of the budget is done by the Legislative Assembly or the Parliament. If there is any matter that pertains to health that emerges from the public, you have committees, you have a committee on health that can conduct this hearing and gathers what people think about. We have not yet reached that level where citizens actually coming out to speak openly about some of these issues. Anyone of us here can say that there is this problem. I want to face the National Committee on this. Okay, of course, you need to make sure that you use all the other techniques to make sure that you get audience or the attention that you deserve, and then be able to talk to the members of parliament, that committee. So that's about public hearing. The parliament is also very important in ratifying international health agreements and treaties. See, South Sudan has committed to, has ratified a number of international agreements, and some of these agreements relates to health matters. So for example, we have what we call, is it the Abuja Declaration? The Abuja Declaration, where we have governments in sub-Saharan Africa committing to at least allocate 15% of their budgets to health. So when the government has committed itself to that declaration, it becomes a policy. Okay. So therefore, it is about the government to implement what it has committed itself to. Okay. So the legislature plays an important role in ratification of these international agreements. We move the second arm of government, which is basically the executive. The executive consists of the cabinet. We have the ministers and then the president, then the vice presidents. Okay, so the president, the vice presidents, who are basically 5 in number, then the ministers or the cabinet ministers forming the council of ministers. These ones are the ones who have the executive power. So they have very, very big, significant role in policy making. So the executive should be independent of the legislature and also independent of the judiciary. This principle, we call it the principle of separation of powers. You should not have the executive influencing what the legislature does, and you should not have the executive influencing what the judiciary does. So the principle of separation of powers is actually very, very important. So the executive does not work alone. It works in collaboration with other arms of government, particularly the national legislature. Okay, like I said, if laws are passed by the legislature, then the president signs them into law. Okay, so the parliament makes the bills, and then when the bill is taken to the president and the president signs, it becomes an act of parliament, which is basically a law. Okay, so that means that the executive works with the legislature. Okay. So also the executive can initiate its own policy proposals. Okay, and then the parliament can look into debate about these policies. And usually, of course, if the government in power often has majority members of parliament, and therefore most of the things that they propose can easily go through the parliament. Often, the term rubber stamping is used to say that um, the, the parliament cannot take its own stand on matters, but basically it's like an arm, an auxiliary arm of the executive. I hope you get that point. Is that a minister can come up with a proposal, okay, and then that proposal is approved by the cabinet, and then you can have this proposal passed to the parliament. Then the parliament can debate, make adjustments, and then pass back, and then uh, sign to. So it is very important for you to know that if you want to get attention, if you have a way to connect to the presidency or the executive, it is much more easier, okay? Because the influence and power, of course, is huge at that line. So it means that um, policies that are aligned with the president's vision and priorities will always be given priority. And this is where elections become an important matter of policy. Okay, the if you have the policy recommendations coming from the president, then they will actually be looked at first. Okay. Okay. Of course, like I said, that it comes from the executive, approved by the legislature. Now, the executive will actually be in position to oversee the implementation of the policies, and sometimes through its different agencies. Or if there is need to form another government agency, then it will actually be formed. And usually, of course, if another agency is to be formed, it has to go through the parliament again. So agencies, but still, also the president has the powers to form their own um, units if the matter is actually very very important without necessarily consulting the parliament. So that can also happen. So it means that the relationship between the parliament and the executive, uh, it is quite, you need to understand the dynamics. Okay, the executive has the power, but it does not necessarily have to overshadow the legislature. Okay, so that is very very important. Okay, so the president can issue out decrees and regulations, but it also has to be on matters that are really very, very, very important and urgent. But if the matter is not very important and urgent, then the legislature should actually do their role. Okay, so that is very, very important in making sure that there is no undermining between the executive and the judiciary. Okay, so if you have the president uh, with his own policy agenda, it is very easy for the National Legislative Assembly to actually prioritize these. Often because the government in power has more MPs, and therefore they can easily push for it. And they also have the resources to make sure that they can actually push what they want. Okay, and then also, if there are matters that need explanation from, let us say, the committees of parliament, the committees can interact with the council of ministers to make sure that they really understand and present some of these issues, whether there is mutual understanding, okay, and consensus building. So those are ways in which the executive can actually interact with the judiciary. Okay, but of course, at the moment, we are facing a number of challenges as a country. Uh, the legislature is not that strong, of course, because partly you could say that the members of parliament are appointed. So they may not be as vocal as you could think they could be if they were actually having the mandate of the people, if they were voted into the parliament. So you have matters there where the executive is like more powerful than the legislature. So, but again, the other major issues, the wars. Okay, with the wars, we are having a constitution uh, which is not really tested very well, because we have a transitional constitution. This constitution, the process did not involve the citizens extremely at an extensive level. So we have those challenges with constitutionalism, with separation of powers, to do with the weak accountability infrastructure. Okay, issues of corruption, transparency, and the accountability are still low. So we have a lot of problems. The public is not participating as what you would want. Okay, so basically those are the dynamics in terms of the arms of the government. So I picked out one particular health policy, and basically I want to basically want to let you know how it actually came into existence, and what are the dynamics. And so this is basically about the national health policy for South Sudan, uh, which I think starts from is it 2020, 2026, I think, if I'm to remember. For that policy, the national health policy for South Sudan, the Ministry of Health is the one which led the formulation, implementation, monitoring. The Ministry of Health also had to ensure that the national health policy is in alignment with other national policies of the country in terms of the constitutional framework, national plans, and global health agenda. Okay, with the global health agendas we are referring to, basically the sustainable development goals. If you're going to make a policy, a national policy for the country, make sure that you are aligned with those agendas. So the national health policies basically defines the vision, mission, goal, objectives, values, guiding principles, and the specific objectives for how service delivery is done, health systems, resources, and partnerships. Okay. And then from the national health policy, you have another very important document, which we call the Health Sector Strategic Plan for South Sudan. Okay, so that health sector strategic plan is very important because it now gives you, it's like you have the national health policy giving you the what South Sudan should look like in terms of health, and then the health sector strategic plan gives you what needs to be done to reach where you want to be. So it gives us the interventions, what interventions need to be done, what resources are needed, how will the implementation be like. Okay, so we should know the relationship between the national health plan, then the health sector strategic plan. It's very, very important to know the difference there. For formulation, of course, formulation of these policies will require evidence, and this requires research, but also in consultation with the different stakeholders. In our context, the international NGOs play a very important role. You also have the civil society organizations. Okay, so when the Ministry of Health drafts this, it submits this to the Council of Ministers, and the Council of Ministers will endorse, and then it will be disseminated and then implemented. Okay, so basically that is that. But like I said, health in all policies, concept or model, the Ministry of Health does not work alone. Okay, it works with other agencies and ministries. So the Ministry of Finance is very important because it's the one which will allocate the money that will go to financing health interventions. Ministry of Education, Water and Resource and Irrigation, and Social Development. These are also very important ministries that should be consulted. And then at the lower level, we have the state ministries, which basically implement the national health policies. Okay, but they can still develop their own policies at state level. Okay, but they also manage primary healthcare facilities and services. They also collaborate with state, with the local communities and traditional authorities, the chiefdoms and the likes. Okay, at the Boma level, Payam level, we also have local governments around there that promote, that support the delivery of health services in the community level. They can also mobilize resources and also address some of the health problems that they have through raising awareness and also advocating for health needs to the state and national levels. Apart from the ministries, we have other agencies that are very, very important in policy making process. The National Bureau of Statistics for South Sudan is very important. This is where you get all the data uh, about the updated data. Of course, we have problems with data, but still you can get some data from the National Bureau of Statistics. And then you have the Anti-Corruption Commission, the civil society organizations, community-based organizations, NGOs. These are all very important organizations in the policy making process in the country. So that marks the end of this presentation. Please, if you have questions, you